Inequality in healthcare has long been a problem in Boston, and some efforts to close the divide go back many years. These include efforts to provide more access to healthcare as well as other needs for people experiencing homelessness. One of those efforts, focused on women and their children, will soon expand with its first freestanding clinic. To tell us about the project is the founder and president of Healthcare Without Walls, Dr. Roseanna Means. Thank you very much for joining us, Doctor.
Thank you. It's my pleasure.
Look, I'm going to start off with your own story. What got you to the founding and why?
Well, I'm a hospital physician at Brigham and Women's Hospital. I've been there for 40 years. And during my training, I spent 3 months leaving the hospital to work with Cambodian refugees after the Vietnam War ended. And before I left the hospital, I was signed up to become a cardiologist, like so many of my peers. And 3 months on the Cambodian border, dealing with people who had lost virtually everything, changed my mind from becoming a cardiologist to taking care of people who are disenfranchised and to focusing my life on social justice. So I came back to Boston and finished my residency and went into primary care, women's health, and joined the staff of the Boston Healthcare for the Homeless program, where I spent 7 years in a leadership position, helping all sorts of homeless individuals, men and women. And during that time, it was very obvious to me that the women needed to have their own special services. And so in 1998, I left there. In 1999, I started my own program. I didn't know what I was doing, but I jumped in.
Well, we think men, women, and children can get special services from a single provider. But in this case, in your program, why the need for gender-specific programs for women?
Women become homeless through different paths than men do. Women become homeless as what they call unaccompanied adults, and also through families. We have a special program for pregnant women who are facing homelessness or who are virtually homeless. And so the paths to homelessness and then the services that are available to them once they become homeless are very different for men and women. And certainly women's biology requires that we need to be in connection with medical care services throughout our lifespan. And so when I was taking care of women and they were in the same waiting rooms as men, and dealing with some of the issues involving street violence, mental illness, being harassed, being stalked, being robbed, being raped. This is not to say that this is what all homeless men do, of course, but what it does say is that the circumstances for women experiencing homelessness were so different and so scary for women that it dawned on me that we needed to find a way where we could go to the women in their safe spaces and address their specific biological and medical needs and do it with confidentiality and autonomy and with what we call a trauma-informed approach, which would allow us to get close to the women and help them close the gaps in care that they so desperately needed.
I imagine these women might have some of the same chronic health problems that a lot of other people have, but maybe they're more likely to have them, and maybe there's less access to care for that. So how do you remedy that situation?
You're absolutely right, Chris, that in this population, there's a very, very high percentage of chronic disease, such as diabetes and hypertension, respiratory illness, COPD, emphysema, musculoskeletal disorders. It's not enough to have a primary care provider on a mass health card. Sometimes the women have to spend their days having their survival needs met. So they need to go get food and they need to be in a warm place and they need to have someone to talk to try to get a housing application done. And so they can't make it to their primary care. And what we do is we fill in those gaps. We are in those places where the women come in to have their survival needs met and make ourselves available in the communities where the women are present and bring our services to them, literally on the street or on the sidewalk, in their shelters or in their short-term apartments, and in the clinics that we've done. And for that reason, we are able to improve the chronic status of these conditions, improve the blood sugars, improve the blood pressures, let the PCPs know, and let the women know that if they need to have any kind of intervention before they can make it to their PCP, we are here for them.
Well, caring for chronic condition especially, it means you got to organize things. Even if you're a patient, you got to organize them. You got to use your mobile phone. You got to figure out how to use an app. You got to make sure you get the meds. If you live in a house and you have employer-sponsored insurance, that's enough of a challenge. But for people who don't have that going for them, how do you help them?
Yes, you're absolutely right, Chris, that if some of these women don't have a phone or the phone gets stolen, they may not know who their primary care provider is because sometimes that name is just assigned to them. There are so many little gaps like that. So that's why being able to be near the women, go to the women and invite them into places which are easy for them to get to, allow us to do those steps for them and then communicate that information to their primary care. So that's what gap care is all about. We're not trying to be the PCP. We're not trying to create a new community health center. What we want to have is human kindness, reaching out, treating these women the way we would want to be treated, with dignity and respect, and knowing that there are just a myriad of gaps between when you wake up in the morning and you feel sick, or when you have a chronic condition and need to have it monitored, and having it actually done. And that's what we do. We will even accompany the women to appointments if they are lost or overwhelmed or have mental illness or confused. We do all the things that you would do for a family member if that family member was compromised in any way.
Well, we've learned in the past from Dr. Jim O'Connell at Boston Healthcare for the Homeless. You want to help people where they're at, and you've been doing that in different ways. But now you plan a freestanding clinic. What would that be like exactly?
Well, I'm actually sitting in our new space. We're just waiting for the Department of Public Health to sign off on this space. And we decided to get our own space because we've been using space offered by women's shelters over the years, and that's been wonderful, and we continue to do that. But the pandemic taught us that we need to have a different kind of a space where you can have social distancing and also be available to a larger number of women who are experiencing homelessness. So this space is right in downtown Boston. It's on West Street between Washington and Tremont, right near the visitor center on the Common, within walking distance of all the women's shelters. And so the women can come in and see us on a walk-in basis or make appointments, and they will be seen by one of our clinicians. And then we also have a strong advocacy group in our Bridges to Elders program for women 55 and older who need targeted care. So this is a bigger space. It has more room for social distancing. It's very convenient. And we can't wait to open our doors and give more women from Boston the chance to get our services.
By the way, I know we talked about the way things are normally with all these overlapping problems, but what has it been like for the population you serve during the pandemic?
Well, the pandemic has been for all of us a terrible experience, and we all have our own personal stories, how it's affected us. As for the women, the hardest thing for us was that all the shelter clinics closed, all the places where the women go during the day to get acute and episodic medical care. They all closed, including ours. And fortunately, we were called by Rosie's Place down by Boston Medical Center to do their screening operation. So we've been providing medical screening at Rosie's Place since March. And that was over 22,000 screenings throughout 2020. Our medical team has been there every day, taking temperatures and asking screening questions and observing the women, making sure that there isn't any shortness of breath or acute illness that would give us a sign that they might be sick. So the hardest part for me was in March, April, and May, where before the city was able to socially distance these women out of the overnight shelters, they were still crowded at night, and the infection rate went up to 35%. Even though my staff and myself were all wearing full PPE, I don't think I've ever been as scared taking care of a population of people as I was during those 3 months. And remember, I worked in a refugee camp on the Thai-Cambodian border and around armed guards. And even that wasn't as scary as this, seeing the fear and the confusion and the mistrust on the faces of the women, and knowing that they had no idea if they were going to get this awful disease and if it was going to kill them or not. Very, very scary. And what we did in response to that, in addition to being the medical team at Rosie's Place all this time, We also ramped up our outreach from our Bridges to Moms and Bridges to Elders programs. Bridges to Elders, as I mentioned, helps women 55 and older. Bridges to Moms helps women who are pregnant and getting their maternity care at Brigham and Women's Hospital. And through text messages, phone messages, telehealth, and meeting people on the sidewalk with full PPE, we were able to do all the kinds of services that we usually provide, giving out cab vouchers to get to medical appointments, bringing grocery store gift cards. We spent $10,000 on grocery store gift cards alone to fill in the huge gaps in food insecurity that we were
Well,
seeing.
you've just reminded me why you have to do another fundraiser, a big one coming up, especially in connection with the clinic. So tell us a little bit about how people can help with that.
So we're really happy to announce that on February 25th, we're going to have a virtual fundraiser, and it's called Broadway Smashes COVID. And it's going to be an hour to an hour and a half long show hosted by Chris Mann, who is a performer, entertainer, internet sensation, YouTube sensation. He has played the Phantom in the Phantom of the Opera on Broadway. He has pulled together an incredible lineup of performers who have jumped at the chance to help Healthcare Without Walls through their various performances. We have Renee Fleming, we have Heather Headley, we have Barrett Foa, we have Cheyenne Jackson. I mean, people that these are Broadway and Tony Award winners that are there and Grammy Award winners. They're giving us their time and their attention to help us raise money to get this clinic open so we can help more women.
And where can people get more details about how to do that?
They can go to our website, healthcarewithoutwalls.org, and they can hear about that. There are 2 price points, one regular price and then one price for students. It's not expensive. It's a great evening. It's a great cause, and it will help us open our doors and provide medical care and loving care for so many more women that deserve it in Boston.
Well, thank you very much for taking the time to join us and talk about your work.
It's my pleasure, Chris. Thank you so much for having me.
Dr. Roseanna Means from Healthcare Without Walls.